Good afternoon and welcome. My name is Daniela Casas-Lopera, and today I will be talking about the health promotion approaches in Norway. To really understand why these approaches are made, we need to understand that health is wealth, but also a human right. As we see in this diagram displayed on this slide, we see how the societal well-being is affected by the health systems, health, and wealth. Also, another aspect to consider is the equity in health. Equity in health is an overall good, globally, nationally, and locally. Yet, health inequalities are significantly related to socioeconomic statuses, and they persist within and between countries by some measures, and in some places are increasing. Those inequalities can be mapped on a gradient, shaped by the distribution of the social determinants of health, related in turn to distribution, power, and resources as determined of political choices at all levels. For decades, social equity in health has been an explicit political goal in the Scandinavian welfare states. And Norway epitomizes that model with its emphasis on solidarity, broad distribution of policies, and fair distribution of services. And these services have recently showed the inequalities in health. This evidence has provoked a new policy reforms, particularly since the 2000s, to raise health statuses of groups that are less well off as to level the health gradient. But what role does Norway play in this whole equity in health? Well, Norway is internationally known today for its political and socio-economic prioritization of equity. The 2012 Public Health Act, the PHA, aimed to further equity in the domain of health by addressing the social gradient in health. The PHA's main policy measures were first, to delegate to the municipal level of responsibility for identifying and targeting underserved groups, and secondly, the imposition on municipalities of a health in all policies, which is also known as the HIAP or HIAP. HIAP is another approach which is the health in all policies, and it stipulates that health impacts to be taken into account in all areas of policymaking. The HIAP approach encourages coordination and collaboration both horizontally across various sectors and vertically among authorities at local, regional, and national levels to really achieve high levels of public health broadly shared. The HIAP approach also aims to foster an explicit health focus through the whole of government, which policies to support and improve public health. This is seen as a broad governmental responsibility rather than the health sector alone. And the coolest thing is that Norway, among other countries, they have implemented the HIAP approach in national and local public health policies. Now moving forward, another approach that Norway has taken is the Norwegian Public Health Act of 2011. This Health Act is based on 5 fundamental principles. One, or first, is the health equity, a fair distribution of societal resources in a good public health policy. Second, health in all policies, which we've already mentioned, which is the HIAP, which is a joined-up governance and intersectional action. And these are keys to reducing the health inequities. Third, sustainable development. Public health works needs to be based on a long-term perspective rather than a short one. Then fourth, we have precautionary principle, which is the absence of scientific consensus of harm and this cannot justify postponing action to prevent harm. So basically, preventive medicine. And then fifth, participation, which is a key to a good public health development. As we can see in this graph shown in this slide, because of this lack of inequity, or more to say, this equity in health, the life expectancy in European countries, specifically in Scandinavian states, has increased over the years. And that was a little summary or rundown of the Norwegian approaches of public health. I hope you enjoyed it and you learned a little bit, and hopefully we here in the States start doing something related to that, because as we can tell, the life expectancy increases as a whole, and public health is an overall good. Thank you so much for watching, and all the information was obtained by the following sites mentioned in this slide. Thank you.